Welcome to another episode of the Your Company Health podcast. We're excited for you to join us today. We have a fascinating guest, Rebecca Andrews. Hi, Rebecca. How are you?
I'm great, Andre. How are you?
I'm doing well. I'm doing well. I'm so excited that you're here today, and I know our audience is definitely going to get some gems from what you're doing and how you're growing your company. So, firstly, just tell us about what you do and your company.
Okay, thanks for the opportunity to have us on. That really means a lot. So my company is CBM Medical Management Services. We are a revenue cycle management company, as well as we have a virtual front desk assistant service that kind of works a little bit like a call center. And we specialize in mental health. And that's the way that we kind of rock it out. Any provider that is in the mental health specialty, we can certainly help them. Psychiatrists, psychologists, neuropsychologists, LPCs, we offer a service that can be beneficial to anyone that is in the mental health field.
Awesome, awesome. And Rebecca, we must say this, it's actually Mental Health Month. So do you guys do something special this time of the year?
You
Or?
know, typically we don't, to be honest, we don't. We all talk about it and we're aware of it. As the president of my company, I usually use that time of the month of May, to try to do one on ones with each one of my people and just check in with them and see how they're doing and make recommendations that, don't feel a stigma, don't feel embarrassed if you feel like you need to talk to a counselor. We work with counselors all day. And so that's kind of how I've been rocking it out in the past. But this year, I think we're actually going to do like a big Zoom celebration. And I'm trying to get folks at my church and some other people in my neighborhood and community to kind of get together and just talk about mental health. I'm a brown lady. And, and in my community and your community, because you're a brown man, that's a stigma. It's not something that we have always felt the freedom to talk about. And even in some cases, we were made to feel ashamed that we felt like we needed to go and get some help. And that's just simply not the case anymore. And the world is a very trying, constantly changing place. And things that we knew back when I was a young girl and the way that things worked out don't always work that way anymore. And you just kind of need some help sometimes to get unstuck.
Hmm.
So yeah, National Mental Health Month. It's amazing. Everybody should, hey, take the time to examine yourself. And if there's anything in you that you feel like you need to just talk to somebody other than family and friends, that is going to keep your confidence and you can talk to them about anything, then I encourage you. This is the month. And a lot of clinicians and counselors, I'll tell you this, have specialty prices. And this is the month. So you might want to knock on one of their doors and kind of see what are they doing for the National Mental Health Month.
Awesome, awesome. So, Rebecca, and I know you mentioned that your company focuses on mental health. So, when talking with different clinicians or company owners, uh, when there always is a backstory to why you're in a specific vertical, or why you're passionate
Yeah.
about what you do. Tell us the story. Why mental health?
Well, for me, the story is very simple. My kids at a very early age needed help. And I came from a typical, I was a single parent for years with three kids, had three jobs, and the struggle that many single parents know and are living out today. And my kids had some experiences that required that I get them into counseling. And it is the counseling by going with my children. I got a chance to benefit from that counseling. And I'm the kind of person that's loyal. So when I saw the work that these counselors were doing with my children and even myself and how beneficial that was, I just made up my mind that one day when I start my medical billing business, I want to help counselors. And that's what put me on the path to mental health.
So actually, I know there was a story there, but and it's clear now why you're doing what you're doing. So I want to tell our audience about CBM. What are the specific services that you actually offer to these doctors?
Well, that's a great question. I mean, we offer the basic revenue cycle, billing, collection, reporting, that insurance verification, but we do specialize, and it might sound a little bit funny that in mental health, there's another subspecialty, but there is, and it's kind of a hidden gem. Not a lot of people know about it. And so what I'm talking about is TMS, transcranial magnetic stimulation. So our company has a division in it that focuses just on TMS providers. And these are medical doctors or businessmen that have opened up TMS clinics. And we focus on servicing them. It's a very unique niche, and it requires a lot of specialized services and expertise in certain services. So
yeah,
that's it.
And I know you explain what TMS is, but for the person that's just listening or watching and they're saying, yeah, those I don't understand those terms that you mentioned a while ago, TMS, but let's break it down a little bit.
So TMS, as I said, it stands for transcranial magnetic stimulation. And what that is in a nutshell, it's a chair that has been designed by, venture capitalists. Lots of different companies design these chairs. And this chair comes with some unique capabilities. It has like a magnetic stimulation. It's called an arm, for lack of a better word, or to make it clear to people. Some people call it the magnetic coil. That's the correct term for it. That just rests on the top of the patient's forehead, and it stimulates the brain with magnetic waves that are like the feel of an MRI. Mm-hmm. The reason why someone that is struggling with depression would want to consider this treatment is because we call TMS the treatment that wakes up the happy chemicals in your brain. So everybody's brain has got chemicals that are released. The depressed brain, those chemicals that maintain our level of depression or keep us from being depressed, those chemicals in a depressed brain are no longer being released in a healthy way in that brain. So when a patient gets connected to TMS, that magnetic stimulation on the brain can actually help them to start releasing those chemicals again. Hence, getting them back into a regular routine. They start to feel like life is worth living again. They find interest in things that they lost interest in years ago. There are some qualifiers, though, that people want to know. And so if you're interested in TMS, there's a couple of different ways to get connected to it. You do want to find a clinic that's offering TMS. Lots of psychiatrists out there are doing it. One of the major qualifiers for TMS, if you're going to use your insurance, is that you have been diagnosed with major depression. And if you've been diagnosed with major depression, you're going to know. If you're unsure, then my recommendation is make a visit to your psychiatrist, the person that's got you on meds, and ask them this question: would you consider me as a majorly depressive person? Another really important option about TMS that I just love, it's actually two. It's non-invasive. So you don't need to take a shot. There's nothing about TMS that's going to require that you have any invasive work done. There's no preliminary blood work, none of that. The third thing that I think that's just amazing about TMS is that it really does give you, or it can, for everybody, it doesn't happen right away, but it can give you the option of getting off of medications. Most depressed people struggle with just being able to remember to take their meds every day. Mm. And I get that. If it's hard for you to get out of bed, if it's hard for you to remember, if you're feeling tired, feeling sad, who's going to remember to take their medication? It's probable that you won't. So many people do, because when they do, they feel better. But with TMS, it does give people options. And I like having options. And one of those options that's just amazing, and I've seen it happen in many patients' lives, is that they get off of their medication. And right. That's an amazing opportunity.
Would this be referred to by a regular general practitioner? Or if you go to you for annual checkup, would they refer you to that TMS doctor, or you have to seek it out yourself? How does it
Well, that's a great question, Andre. If your general practitioner or your primary care physician is aware of TMS, then, and they're aware that you are majorly depressed and you've got that diagnosis in your medical chart, then they could absolutely make a referral to you to a clinic that offers TMS. However, most people find out about TMS from their psychiatrist, or they'll find out from TMS from their mental health care clinician, LPC, licensed professional counselor, LCSW. Any mental health professional is aware of TMS or should be aware of TMS.
All right, so let's move into growing a practice. Talk to us about some of the problems that these TMS doctors or clinics face.
Well, I can tell you one of the biggest problems that a TMS clinician faces is marketing your niche, which is kind of what has brought us together. Because right. Doing what I do, I come in and I try to give the provider like a vision for their clinic. And I've walked many providers through that, so I know what a good, healthy TMS clinic look like. So one of the things that they want or they need, and oftentimes it's hard for them to wrap their mind around it, is that TMS treatment has its own niche marketing that it needs, and it functions well if they've got it. And that is one of the biggest problems that I find that a TMS provider just starting their business encounters. Where do you find TMS marketers? Who's good? Who's not so good? Where do I place my investment dollars? So that's usually one of the first problems that they encounter. Along with maybe a second problem would be credentialing. Most providers, and it is advisable, I advise them on a regular basis, that if you've already got a practice going, let's say, for example, you are a psychiatrist and you're opening up a TMS clinic. If you're not going to run your TMS business under your current tax ID, then I recommend that you set up a separate business. In setting up that separate business, you're going to need to get that second business credential. Overall, even if you don't, if you're a psychiatrist and you're just introducing a TMS chair into your current business, you have to contact your insurance carriers and find out, are the codes that I'm going to be using to bill for the TMS treatment covered under my contract? Surprisingly, in most cases, they either are on the provider's contract with a very small, unacceptable, low fee schedule number. This is what the insurance carrier will pay the doctor, or they're not on their insurance contract at all. And work has to be done to get them added. So those are the two major factors, in my opinion, that providers face when they're starting a TMS business.
So talk to us about how does your company help these doctors in solving these problems and improving efficiency in these practices?
Well, if a doctor connects with CBM, we have tools and services where we come in and we help them get started with all of these things. We do what we call for every provider's office a vetting process. And that vetting process is just, is your tax ID number, in good standing? Is it really your tax ID number? Is your business and your tax ID number connected? How are you looking at the insurance carrier? That's where we really dig deep. And that's typically where we find that either these providers don't have the TMS codes on their fee schedules, or they've got them, but the fee that's attached to it is very, very small. So that's the major way that we come in and start helping them, is with the vetting process. That vetting process will then kind of give us some insight into what else the provider needs. And I can tell you the next thing that pops up is going to be marketing. Well, how do people know about my TMS? And that's one of the things we recommend is the way that you market a practice, just a general practice, just to tell somebody, hey, I've opened up my own practice, come in and see me. This is how I can service you. It's very, very different from how you market for TMS. TMS is first of all, your ideal candidate and your audience that you want to capture are depressed people. So when are you going to capture those people? In the middle of the night. I had a clinician reach out to me last week and said, hey, do you have another rep that you can possibly give to us or assign to our clinic that can help us monitor all of our responses that we're getting from our marketing that's coming in overnight and on the weekend? And Andre, I can't tell you how many times I hear that. A lot of the outreach that you're going to get from marketing is going to be overnight and over the weekend. But this is a very specialized marketing that definitely is going to require somebody that's familiar in how to get into the nuts and bolts of the type of client you want to attract, and they can get that set up for you pretty quickly.
Awesome. So Rebecca, because as you mentioned, is very specialized. So I know there are not a lot more companies like yourself, but for the few companies out there, I know a doctor may say, what differentiates CBM from the competitor, or what makes you unique?
Well, that's a good question too. And I would say the first thing is, number one, we specialize in mental health. There are a lot of companies that are out there, and there are a few that actually specialize in TMS. I believe that what sets us apart is that when we meet with the doctor and we agree to work with the doctor, we become that doctor's partner. And the way that we become your partner is that we build up a team around you. I believe that it takes a village to raise children, and it takes a village to create an amazing, fine-tuned working machine of a practice. And that village is what CBM brings to the table. That village is filled with knowledge. It's filled with expertise in several different areas where we can pool that expertise together to help that clinician or that clinic meet their goals. Another tool that we have, another opportunity, is that CBM has also partnered with another company that consists of a business specialist as well as another clinician. And what they are doing and what we're doing together as a partnership is, and we're bringing marketing along with us, but what we're doing is we're pooling together our expertise. They are amazing at the business structure of it, how and what a clinician or a clinic might need to do to manage the business end of the business as they start out. The clinician, he actually brings to the table his protocols and suggestions on how to get patients through the actual treatment where it's going to give you a really good outcome and give the patient a great outcome. And they've been there and they've done that. So they've got a clear understanding. And then I come in on the revenue cycle side, and I can give you that expertise and advice of, hey, this is what we need to do to build up your TMS clinic. And when the doors open, you're set up for success. And together we've proven to be a very powerful company. And I think that's our secret weapon, along with our call center. Call center makes a huge difference. And that's the reason why you would want to choose to go with CBM. If you're looking for success sooner than later, then you really want to give CBM a call.
Yeah, and those are some great advantages by your company, Rebecca, because I know the idea of being the trusted advisor, that's so important. And even our company,
yes,
we try to be that. You know, some of our clients call us about, hey, Andre, refer me to a realtor. You know, like things that are different from marketing. So when you
yes,
do that, you build that trust, that loyalty, and what you're doing is really good. And also you touched on, you know, having that clinician, you know, as a part of your business. I think that's really big, because not only you're targeting these doctors, but you have one of them on your team that doctor that knows the strategy, knows the ins and out, and knows how you know, you should position yourself to reach other doctors.
Well, Andre, it's what brought this partnership together is that the businessman and the doctor approached CBM and asked CBM to join their team. Mm-hmm. And these are actually clients that CBM has. And when we met these clients, they were exactly where I'm talking about right now. They had just opened up a TMS clinic. They were working with a biller that was not familiar with TMS and all the specialized things that needed to be done to ensure a doctor is paid for his services. And so they showed up on our doorstep with about $200,000 outstanding, and they had no real clue about how to get it. They knew they could get it. They wanted somebody that was going to work hard and go out there. And it took me a minute to convince the doctor that I know we can do this. The things you're telling me and what you're showing me on the screen doesn't scare me. I know we can do this. And so finally, he gave us an opportunity, and we helped them collect about $190,000 of that 200 outstanding that he was going to just lose, staying with the other company. And from that point on, we have just continued to grow. They are now on their second clinic, and I can tell you they're doing amazing. They put up some amazing numbers, and they just want to help other doctors do the exact same thing, and I do too. So that's why we made the partnership.
Great, that's great. Let's talk about some big mistakes you see clinicians making in growing their practices.
I would say the first one is the credentialing. A lot of the clinicians that show up on my doorstep, they're having problems with claims getting paid. They think that they're not making as much money as they should. That's usually what drives them to start thinking, hey, I need to check out another biller, or if they're doing it themselves or in-house, I need to get an outside opinion of what might be going on here. And Andre, it just has never failed that in some shape, form, or fashion, it's connected to credentialing. It's either they're billing a code that's not on their contract, and that's so important. And I believe that clinicians are slowly starting to learn that the credentialing process, the process of getting connected to an insurance company, getting in the system with the insurance company, making sure they know you and you are aware as to what your relationship status is with them. Are you in the network with them? Are you out of the network with them? Are you in the network with them, but you're just at a participating level, which means they know you, but you're not at an in-network status. So there's a lot to that. But the number one problem is credentialing. Mm-hmm. And honestly, I would say the number two problem is having the right partners on their team.
Right, right. Well said, well said. And I know there's a doctor or a TMS doctor listening or watching us. You hear it, you know, you got to get your credentialing right, and you got to get your partnership right. So Rebecca, as we're winding down, just tell us, what does a great client outcome look like to you?
Well, an example of a great client to me is somebody who wants to grow. I mean, for me, that's it in a nutshell. Somebody that wants to grow, because the tagline of our business is helping those who help the hurting. Well, I want to be involved with helping as many people in the mental health community as I can. And I see that Doctor has a fairly large group of clients. They've got a large client base, or at the minimum, they're wanting to grow. The way that that looks like to me is a client that, you know, shows up and they're interested in, you know, what can I do for my clients? What services can I offer to my clients that's billable to the insurance carrier, that's going to be a benefit to the client and me, and know that I can get paid for them.
I want to tell our audience, how can we reach you? What's your website?
My website is cbmmedicalmanagement.com. Please check it out. It was built up by yours truly, Andre Wright, and Wright Consulting. So it's an amazing website compared to what I had. So there are lots of different ways on that website that it indicates that you can contact us. So you can also give us a call. We have an amazing call center that would be happy to take your call. Our phone number is 214-295-5890, and we'd love to hear from you. Even if you just want to reach out and have a conversation, that's where it starts. I'm up for a good conversation.
Yep, awesome, awesome. And Rebecca, of course, it was a pleasure working with you and your team, and we look to work with you even in the future. So thanks for dropping by the podcast. It was a blast, and we'll talk soon.
Yeah, Andre, thanks so much for having us. We enjoyed it as well.
All right, thank you.